Alrighty. I'd like to welcome everyone back to another episode of King's Tales, the podcast series centered around raising awareness on certain topics that are prolific in the Black community, particularly affecting millennials and Gen Zs. On today's episode, we will be tackling how to overcome perfectionism and anxiety, and we have a very special guest helping me out on today's episode to talk a little bit about anxiety. And without any further ado, I'm going to grant her the opportunity to introduce herself, tell you guys who she is, what she does, and the impact that she's had on the lives of the people that she's interacted with. So without further ado, I'd like to introduce Miss Stacey Edney.
Hi all, thanks for having me, Rex. My name is Stacey, of course, as Rex introduced me. I am a licensed professional therapist, and I've worked in a lot of different facets, but what I've come to realize is through my profession is that all people who come to therapy are people who just want relief, right? So for me, there's not really a stigmatism on why you're sitting across from me, but just that you're saying, hey, I need to release, right? Some information. I don't know if you want more from me, I'm not sure what, like when you asked me to introduce them, what I do. I work with people from all age, not really all ages. I like to work from ages 16 and up.
Okay.
Yeah, because I feel like, at that age, you're able to transition and make the decisions that you need to make, and not so much of parental, like your parents are there. However, you still can change and reset and reframe your mindset.
Absolutely. That's really awesome. When you first started studying mental health, what made you want to become a mental health therapist and not a psychiatrist?
Well, I stumbled across my profession first and foremost. I was in school actually because I wanted to be in a helping profession. That I didn't know, but I thought I wanted to be a nurse. So I was in school for nursing, and I think it's the last 2 semesters. So I had psych, and I think it was geriatrics, can't remember, but all I remember is psych. So when I was in my psych rotation, I realized I didn't want to be on the side of the nursing. I wanted to be on the side of the mental health. And the reasoning behind that is because, growing up, I wasn't taught how to deal with emotions, right? It was more so of do as I say and not as I do, right? So there was no space for talking about how you felt, right? No, that didn't matter. So once I got into the profession, that's what my like the main thing I like to work on with people is them having a voice.
Wow, that's honestly amazing. Part of the reason why I started this podcast in particular is it's a very similar upbringing. Like when you're growing up, especially in a Black household, you're there to be seen, not heard. So a lot of the times, you feel like, okay, I'm just gonna, whatever it is I'm dealing with, I'm just gonna keep it bottled up inside, and I'm just continue to push through because I've seen everyone else around me do it. I've seen my parents do it, I've seen my older cousins do it. I've seen, my aunts and my uncles doing it. So, it kind of becomes normalized. And
and so you can't push through anymore, then everybody's looking at you like, well, what's going on with the strong one? Why is the strong one breaking down?
Right. It's so crazy.
Yeah.
And especially, just speaking from experience from being the strong one myself, I don't know if you've also had to go through it, but, everyone's looking up to you. I'm the oldest of 3. So I have 2 younger brothers that look up to me, and in a sense too, I'm my parents' firstborn child. So they're looking at me for strength too. So
the example,
literally everyone's like, oh, that's right. He's the strong one. He's able to push through it, and then eventually you get to a point where you're not so strong. You're like, well, who's gonna be strong for me?
Exactly. And so that's where we have to keep in mind. And I had to learn it because it's a skill, right? Just because I have a compassionate heart does not mean that I just freely give it to whoever. You get a piece of my energy, you get a piece of my energy. No, it has to be very selective. If not, then you're stuck having to fill your cup up over and over again because there's really no one pouring into you. So you have to be able to pour into yourself so that you can keep going. And some people look at that as being selfish, but again, if you don't take care of you, who else will? We're not taught that either, right? It's take care of everybody else, and a little tiny bit that you have left, that's what you give to yourself. That is false. I had to unlearn that behavior.
That is wow. You just
Mhm.
said a mouthful right there. And one of the words in my vocabulary right now is unlearning. There's so many things that, you know, we were taught when we were younger that it was normalized because it had to be normalized.
Mhm.
And, you know, as I got older, I started to realize, oh, hey, you know, some of those practices, some of those behaviors, some of those thought habits that we had, they're not really meant to be normal. And we keep
No.
so many things internalized that, you know, eventually you reach your breaking point. You just want to, you turn to the volcano, you just want to explode.
Yep, I call it a confetti party. So I'll be like, it's like you start with a thought, and that thought could be, they don't care about me. They only want to use me to turn off the lights when they want me to come up, and they only want me to do this. And so it starts here, and then it turns into that feeling of resentment, and then it turns into a
Mm.
beautiful behavior. So I say that's when the confetti come out, and it's party time because we're about to show out, right? Nobody knew.
That is such a beautiful acronym for it. Like instead of,
Mhm.
you know, because volcano eruptions can be a little bit violent, and you know, confetti party kind of like censors it a bit. So
Yeah.
I like how you did that.
Yeah, it's like, listen, it's about to be party time, but y'all don't know what y'all about to be celebrating because it's about to go down. You know, push the last button. Oh,
Oh
yeah, I get
man,
it.
that is a really this is a good introduction segue, especially into today's topic, which is, you know, overcoming perfectionism and
Yeah.
anxiety. And just based off of, you know, what we just discussed, like sometimes we feel, especially like when all that pressure's on you, like you have to be perfect and there's no room for mistakes, there's no room for failures. And I kind of made that association from, I think it was around like 11 or 12 when I came to the realization. I was like, huh, you know, if, you know, they're expecting all this great things from me, then, you know, I obviously I'm gonna try my best to avoid making any mistakes, because if I make a mistake, then everyone else is gonna feel like, you know, I let them down. And so now we're taxing on more and more things. And I felt like I had to be the one that set the example, that leads everybody. And can definitely become crippling if
Yeah.
left unchecked. So my next question for you is, what life events or situations can trigger the onset of perfectionism?
Oh, it can be anything. Again, as I follow and track people, telling me their life stories, it's more so of people pleasing with perfectionism, right? So you're trying to please
Mm,
everybody around you, make sure things don't drop or fall. But guess what? If they're going to drop and they're going to fall, you can try to make it perfect all you want, but it's never going to go the way that you expect it to go most of the time, right? But that's a good thing. And we'll never get started with anything if we want everything to be perfect. If you notice people who that's a lot of stress, and imagine what stress is doing to the body, right? And then comes the symptoms. So, say perfectionism is that's the issue,
mhm.
right? So then now your body's going to give you all of these symptoms, which translate into anxiety.
Yes,
Yeah.
literally.
Mm-hmm.
And it took me until I was around my sophomore year in college. I developed like really bad anxiety, but I didn't know that it was anxiety. I just thought that, all this stuff that I was dealing with was just starting to overwhelm me a bit. So I was like, okay, what eventually ended up turning into my coping mechanism was taking naps after
Oh.
taking naps after I got done classes in the morning. So I'll head back to my dorm room, take like an hour nap, and then I'll be like, okay, I'm fine. I'll continue to keep pushing through it. And one thing that I realized was that really wasn't helping me, and it
Mm-hmm.
eventually becoming a crutch. And I went from taking 30 to 45-minute naps to taking 2 3 hour naps. And
Oh.
and especially when things didn't go the way that I was intending them to. Like if I got a really bad grade on an assignment, or let's say that I had poor at track practice, or just the day wasn't going the way that I wanted it to. I had this mindset that I had to be perfect. So when things didn't go perfectly, I was like, oh, okay, something's not adding up. So let me take a nap, try and reset and see if that'll help me. And it didn't.
Nope.
So I think this is a really good segue into the second question that I had. What's the correlation between perfectionism and anxiety?
Well, I'm more so of okay, so I'll give you my answer. Okay.
Okay.
So the correlation to me is just I ask questions. So say somebody comes in and they say, I'm just gonna give you an example so you can better understand me. If they
Okay.
say, hey, I have anxiety, the reason I'm gonna ask questions until I figure out where's this anxiety coming from, right? And then it may be perfectionism, it may be something else. But once we figure out that it is perfectionism, then we can work on trying to decrease those symptoms of not being perfect, right? As looking at if the ball do drop, if the ball fall, it's not the end of the world. So how can we think of how can we take perfectionism and decrease those, because it's just a high expectation that you have of yourself and others, right? So how do we take this perfectionism, break it down, and then say, hey, you know what? If things aren't perfect, it's okay, which then decreases those symptoms of anxiety. So to me, anxiety is just a symptom of whatever it is that you're experiencing because you're out of alignment.
Mm-hmm.
So what I like to do is with my clients is do core values, and then through the core values,
Okay.
if you tell me yes, no, yes, no, if you have a lot of no's, we're going to work on those core values that have no's. So to me, if stability, say I have this perfectionism because I'm so dead set because stability is one of my core values, right?
Mm.
So if stability is my core value, then I have to work on what's causing me to think that I'm going to fail, because now I'm really just worked up. I'm not worked up about the perfectionism. I'm worked up about not having that stability. So it's just pulling back the layers of finding out where all of this anxiety is stemming from. Where does this perfectionism stem from? It stems from people having, I have all these things on my shoulders, so I got to make sure that they're right. So how do I decrease having this burden on my shoulder, right? And if I can't, how do I modify?
Yeah.
So it's just all about modifying. But that's how I feel like they connect. If I answered your question.
Absolutely. Absolutely. And I like how you said in the instance where, you know, especially stability, I feel like that probably was probably my defining trigger for me when things started to fall apart and I felt like I didn't have a solid foundation to stand on. When I started to find myself getting anxious, you know, for the most part, in my situation in particular, I felt that if I didn't, if I was the standards that I set for myself, or if even if it was someone else that, you know, I was working with, if they weren't up to the standard that I had for them or that I had for myself, then I would start to feel like, oh, you know, work out, or I feel like I have to do everything myself. And my perfectionism was definitely centered around the high set for myself, and then
Yeah.
I would project.
And then when people are in your presence, because
And not
remember,
realize that they're projecting.
yeah, because once you project out, right? Remember, we're energy. So then if I have a standard, I'm projecting it out onto you. And if I'm anxious, then I am giving that energy out. So when people around me, they're like this because I'm like that. Right. So that's where when you see that you're falling into the perfectionism, that's when you have to just check yourself and say, hey, what's going on? I'm out of alignment here because I am trying to do this thing in a perfect manner. Where does perfect even exist? Right.
Mm, right.
Now I'm
That's
creating this narrative in my head that, hey, I'm gonna do this and that's gonna look this way. And then when it don't, we're like,
yeah. And then I think too, actually, like in my prior experience, I would try to rationalize with things that were really irrational. Like I would just literally, as soon as something would go wrong, my mind would go far left, and I would start to overanalyze everything. And actually, when I was doing some research, there was this term that popped out to me. It's called analysis paralysis, where
oh,
you think too much on something and you just shut down. And
mm-hmm.
it's so crazy when I finally put a word to it, because that's why I took so many naps. My brain became fried, and I was like, okay, I can't do this anymore. I need to shut down.
You wear yourself out.
And then but it's so crazy when you put things in perspective and you learn more. Like, wow, that is so crazy.
Yeah, but it all makes sense too. Like, you know, the main thing is whenever you have anxiety, everybody says, oh, these panic attacks just come out of nowhere. No, because your body's telling you 1,000 times before it even heightened, right? So it's like, pay attention to your body. Where does it start? Does it start in your feet, your hands, whatever, before it comes all the way up to the heightened stage? You can always, it's easier when you catch it early than when you're in full blown attack, you know?
Absolutely. Absolutely. So in that regard to being aware of your triggers, I feel like everyone gets to that point where they're aware of what it is that they're going through, but they don't realize that they need help. At what point does someone take that initiative and tell themselves, okay, maybe I need to reach out to somebody and get some help?
Everybody's pretty different, you know? And then from my experience, when people really need that help, guess what? They ask for it or they do something to kind of get it. So I think everybody know when it's their time. I can't say when there's a particular time, right? But I would say as soon as you feel like you have no control over what's going on inside is when you need to make sure that you're reaching out.
Mm.
But even before then, you know, but some people, they get to their place where they're like, they know they need the help and they'll reach out. But yeah, so if you get to a place where it's just too much, reach out for help. What do you really have to lose? You know, what do you have to lose? Reaching
I
out.
think that is a really good point. When I remember I was talking to a friend a couple of months, and they had told me that, when because they were a bit hesitant to get into mental health, like counseling and therapy, because there's this huge stigma in the community of people of color and Black people just in general. Like, I remember the first conversation I had with my dad about me attending therapy. He was like, "You're talking to a shrink," and I remember I felt so hurt because I was like, "Shrink, you're making it seem like I'm crazy," when I'm just really trying to unpack everything that I've dealt with throughout my life to try and get a solid answer as to why I react to things the way that I do. So, how this is a two-part question. I'm going to start with the first part. How can, once someone is willing to seek the help, how can the implementation of mental health services such as counseling and therapy, help them in overcoming, some of these disorders such as perfectionism, anxiety, and depression?
Because you just have a different perspective, and then there's different theories that are used. But again, how you overcome it is we're not taught how to, like, we don't speak with emotion. We just don't. That's not how we're taught, right? So in therapy, you're pushed or challenged to look at things from a different perspective, because it depends on your lens, right? So whatever environment I'm coming out of, that's the lens I see from. And so when you're in therapy, you unpack and uncover and figure out what's causing you to look from this lens, because there are other lenses you can look through, but you're looking through this one. So let's unpack and see what's causing you to look from the lens of hurt or abandonment or whatever it is that you're going through. And let's unpack. And once you unpack it, pluck it up, get it out, then you can see from a different perspective. But if you continue to do the same patterns, use the same patterns, in relationships or, the same family patterns, same things you've been doing, you're going to get the same result. So once you sit down with someone, you get to find out a different way to do things so that you can get a different result. Right. So it's not like a friend. It's not like a family member. No, we're like neutral. So I'm not taking sides. I have no idea what you did to get here until you tell me. I only have your side of the story. There's no judgment. When I'm looking at you, I'm seeing you as a blank slate. I'm seeing you as for you, not all of the things you did to mess up, or all of the things that you said to make family members feel a certain way, so they say, or being rebellious. I'm not seeing that side. I'm just more concerned about your emotions and your feelings, right? And that's it. And how you are making decisions. And, people say, well, this person took advantage of me and they walked all over me. No, it didn't happen that way. What happens is people walk over you because you don't set boundaries nor a consequence. So people can't walk over you without your permission. I'm sorry. So it's like, I'm giving you, come on, no, I don't have no boundaries. Girl, yes, I'll drop everything I have to do and I'll take it to the store. No. I'll take it to the store once I'm finished doing what I'm doing. Okay. So no, then we say, well, that person always call me when they want something, because that's what you set up. You taught people that it was okay to come to you and talk to you about things. But if it's bothering you, let them know. If they can't respect it, set a consequence, a boundary and a consequence, and then you move forward. So yeah, it's just like, that's my take. That's my spew on that question.
It's very insightful, and there's a lot that I took note of that, as we continue this, I'm definitely going to unpack it, because it's applicable to some of the things that I'm still. And you said a really good point. Nobody can make you feel anything. Sometimes when we respond negatively to a situation, it's because we find some truth in it and we internalize it and we latch on to it. And it's so funny because I literally had a conversation earlier with my pastor, and he was like, Rex, no one can make you feel anything. No one can make you think like you feel anything. It might be applicable to you. That's why you get so hurt when people tell you things. And I was like, you don't have to read me right now. And
and now here it is again, confirmation.
It was so funny that. Right. So I'm just like, okay, maybe I have to do some deep introspection and figure out what it is that may have caused me to respond the way that I did, and just change my response.
Yeah, because again, like, I can sit in a room with hundreds of people, right? And I can read any type of book, right? And everybody's going to have their own response to that book. Like, and everybody, like, some people have the same response, some people won't, but that's the joy of it, is everybody have different responses, and within those different responses is your healing. So if I'm feeling triggered by something, then I need to work on it, because this person can say the same thing around 20 people and none of them may have taken it as personal as I did. So if I'm taking it personal, then that means that there's some things that I still need to heal within myself. Triggers are not negative, right? Triggers are there to help us learn what we need to work on.
And that was something that it took a while for me to fully comprehend when I finally started doing my own counseling. I think one of the biggest things for me was go of that control and feeling like I had to be in control in order for things to go right. And it was like almost a 2-for-1, because as soon as I started my counseling is when I recommitted my life to Christ. And I realized that not only are there things in my own personal life that I'm going to have to let go of and just let things be, but one thing about God is when there's something in your life that he sees isn't beneficial for you anymore, he's going to start to cut it out. And one thing that you're going to have to do. Yeah, right. You just want to keep on holding on to it, because you're, whether it was a hurtful situation or a really positive situation, you still try to hold on to those memories, and you feel like holding on to it is gonna somehow make it better. But the best way to move on from things is just to let it go.
Yeah, I have an analogy that I use, and it's look at yourself as a Velcro body, and the world is just throwing these little balls that's supposed to stick to your body. So for all the balls that stick on, you let them stick. But the ones that fall off, why do we try to pick them up and put them back on our Velcro body? They fell off for a reason. Let them stay on the ground. Don't pick them up. Only go off the ones that's trying to stick to you, And so that's where you got to work on letting go. It's like, just let it go. It's not good for you. If it falls off, that's it. Can't pick it up. That's the rules. You can't pick it up.
Wipe your hands clean and move on from it. That is really, really impactful. And I think another thing too that really helped me to not, and it's so crazy, like actually verbalizing it and saying it now, like one of the things that helped me not feel crazy was knowing that there's so many other people that look like me that experience the same exact emotions and thought processes that I was thinking and feeling. They were going through it too. And you know, my counselor really helped me to I guess visualize that
Yeah.
you're not the only person that's going through these things.
No, and there's a lot of people who go through it, but again, with the stigma out here, they don't get the help that they need for it. And again, everybody have these thought processes. It's just a matter of how do we deal with them? How do we work through them versus trying to just push them to the side and act like they don't exist, because they do. Right? So getting the help and processing through it versus pushing it to the side, pushing it down, it's just going to keep popping up. And the more you keep pushing it down, it just gets stronger. You're giving it even more. You have to do more work to kind of work through it. But yeah, it is. It's, if we could just get through the stigma, will be great. I mean, I do see more people that look like me coming, at least starting. It's just keeping it going.
Right. Because not sometimes the hardest thing is just starting something new, especially like when there's so much negativity associated with the world of mental health counseling and therapy. The hardest part is just, you know, taking that leap of faith, taking that step forward, trusting the therapist that you're with, that, you know, taking the journey with you, taking the leap with you.
And so it's like, it's more so just like shopping for a therapist. It's just like having a job that or a career that you're compatible with. It's going to take time, but continue to seek out the therapist, because once you find the one that can identify with you and you feel like you're able to get what you need out of it, it's amazing. The work, if you put the work in it, it's amazing. Like the return that you get is amazing. However, just don't give up on, if you don't mesh with one, it's like, that's it, I'm not doing it anymore. It didn't work for me. Just keep trying therapists out until you find that one.
Absolutely.
Because rapport is important, right?
Beautiful advice. Right. And to transition to the next question that I had, just some food for the viewers back at home. Mindfulness is defined as maintaining a moment-by-moment awareness of our thoughts, feelings, bodily sensations, and surrounding environment through a gentle, nurturing lens. Mindfulness also involves acceptance. How has mindfulness helped both you and your patients in treating the adverse effects of perfectionism? Patients, clients, what's the correct terminology?
It depends on the setting. It could be clients.
Okay.
It could be patients if it's in a hospital setting.
Okay.
So mindfulness helps instantly, right? So for how it helped me in my practice is I like to use body scan, right? And I can do that at my desk. So sometimes I'll be sitting and I'll be like this and I can feel it when I'm typing my notes. So I say, oh, relax your face. And I do it every hour. Relax your face. And I have a little reminder on my cell phone that tell me, relax your face. And then my shoulders will be up here. It's like, relax your shoulders. And you just keep going down your body. And that helps you relax. Another mindfulness technique that I really like to use as well is just grabbing, like using your 5 senses, right? So I can, if my mind is racing, I can automatically go to a picture, okay, that has purple. It takes my mind off of the racing thoughts, right? And then you can touch, smell. Like even with smell, you can use your imagination. Like if I'm not able to, if I don't have anything to smell around me, I use my imagination. Like, say it's an orange. Ooh, I can see the orange. I can see when I peel it back how, you know, juices pop in and all this stuff, and then put it in my mouth, and the taste that I'm tasting of that orange with the juice, like, you know, you can really get that flowing too, just to use your creativity. Mindfulness is a really fast way for you to kind of stop the racing thoughts if they're coming.
Mhm.
I hope that was helpful.
Yeah, it was. And in relation to what you were saying, like with the visualizing and, you know, utilizing your senses to help bring yourself back in. I remember it was the fall semester of my junior year. It was around the time that finals were approaching, and I literally felt so overwhelmed that I had a major depressive episode. I
Really?
literally did not go to class for. I did not go to class for a week. I stayed in bed. I barely ate. I was barely drinking any water, and you know, I was. It's actually funny because like I remember actually like verbalizing this for the first time with my counselor, and then telling my pastor about it. You know, when you're at rock bottom like that,
Mhm.
you're in a sense, you're like, you know, it's not that you want to, but you feel like you just don't want to
Yeah, you
live
don't
anymore.
have,
And
yeah,
I
that's,
was at that point.
yeah.
And one thing that helped me was, you know, realizing that, okay, this is obviously not normal. I haven't gone to class in a week. I haven't communicated with anybody in close to a week. I should probably reach out for help. And people were knocking on my door, checking in with me to see if I was okay, but I was telling them I was fine when I really wasn't. And just coming to that point where I was like, okay, something's not right. Let me see if I can get phone a friend and ask
See?
for some help.
You see from earlier. I told you, you know when to get up and go for that help. I don't care what it is. We all know we know when that limit comes, right? That
Mm,
time where it's like, this is too much. And you went out and you got the help that you needed.
absolutely, absolutely. And I say that not as a means to discourage anybody back home that's listening, but to let you know that, you
I
know,
would do
if
it more.
people can go through these things and still find, you know, still find hope and, you know, find the strength and the courage, because if you're a brave person for going out of your comfort zone and asking
Exactly. I think that
somebody
is,
to help, especially once you know, it comes to the point.
yeah, that strength.
Yeah, so
You know, people think coming for mental health, coming for help for your mental health is a sign of weakness when it's really not. It's a sign of strength, just as if you went to the doctors and you found out that you had a medical condition. Everybody be like, oh, gun, hooray, that you're taking care of your body. But you also have to take care of your mental health as well.
mm,
Yeah.
very
So,
much so, very much so. It's almost like you can go ahead.
no, I'm listening to you. I couldn't hear you. You were going in and out.
Oh, okay. We're almost like cars. You know, sometimes we have to go to our mechanic, get fixed up. You know, whether it's sometimes for most people it's physical. You know, going to see the doctor, going to see a chiropractor, getting an adjustment. But for others, you have to. This is your engine. So if your engine isn't good, the rest of the car isn't going to function.
Exactly. I agree with that. And that's a good analogy to use, Rex, because again, cars are important to us. So once we put the analogy with something that makes sense, people hear that. But yeah, and once you get treatment, once you start treatment, it's almost like anything else. So in my profession, if I'm going to a conference, I'm around people who are like-minded, right? So when I go
Mm,
to treatment and say I need a higher level of treatment, I'm in a space where people are going through the same thing that I'm going through and they can understand, right? And they're working through the same things that I'm working through. So it's just like with anything else, just
mm,
make sure that, I mean, when you're in treatment, it's just you're around people who understand what you're going through. And that's what makes it easy sometimes, right? But again, you have to find someone that you can connect with and that you can open up to, because we can only give you as much or as little as you give, right? So if you come in and you're not being transparent or you're not being honest about things, we're not here to like, we can't say, ooh, this is going on with you and tap, 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 and it's done. No, we follow what you say, right? So if you're telling me you're being honest, then we can get a lot out of it. But if you're not, like if you use the word fine to me means help. Help. So in my sessions, everybody's forewarned not to use the word good or fine. You use good or fine, I'm digging. I'm coming.
Digging, right.
I'm coming for you.
That is so true.
Mm-hmm. They'll be like, I'm fine. What
And
does that mean?
I think sometimes too, what does that mean? And I think one of the things too, like I remember, especially like when I was like younger, like in middle school and high school, I used to be the counselor for all my friends, and there were certain words that I would pick up on. I was like, "Are you really good?
See,
Are
you
you
get
really
it.
good?"
Yeah, it's like, okay, good. It's so broad. It's so, it's good can mean so many different things for different people. Yeah, so it just helped people open up just a little bit.
Absolutely, and I like what you said about, you guys are only able to help as much as someone is willing to accept that.
Yep.
And I have this saying where, you can put the plate of food in front of somebody, but it's up to them to decide they want to eat from it or not. So
Yeah,
you can't take the help if you don't want it.
exactly. And so when you get to that space where you keep hitting the big brick wall, it's like, are you ready for treatment? Maybe not.
Mhm. Absolutely, absolutely. And I think one thing too that can, in a sense, hinder someone's willingness to accept the help is, if they've been hurt before, if they have a tough time trusting and being vulnerable with somebody, which was one of my biggest issues. If I didn't feel comfortable enough to talk about something with someone, I'm not gonna do it, no matter
Exactly.
how hard they try and pry and dig.
If you're not ready, you're not ready. Or, my biggest thing is don't think you're always stuck with the person that you're with. Like if you feel like you can't freely tell this person or your therapist
Mm,
how you feel, you need to go on to the next. So that's telling you that resistance is telling you that you're not opening up to this person. So don't waste your time, because the goal is for you to get the help you need. Yeah.
absolutely,
And
absolutely.
some people stay, they will stay because of loyalty, they'll stay because of so many different reasons, and they're still not getting what they want. So we have to watch that as well.
Mm, listen, that is very, very true. And I guess before we wrap everything up, because I'm almost at my final question for this interview, I think one piece of advice that I would give to anybody back home that's listening in or watching the video version of this on YouTube, whatever it is that you're going through, realize that you're only as strong as you allow yourself to be. And once you start to notice those chinks in your armor, and you realize that okay, there might be something that I need to get fixed or get some maintenance on, you're only going to be able to do as much as you're willing to help yourself with. So
Mm, I agree with that.
which,
That is so true. Yeah. Words for wisdom.
if you and this is the last question that I have for you, if you had any tips or advice for any of the listeners back home that are tuning in, how would you recommend going about seeking treatment for mental health disorders once they are willing to take that first step of asking for help?
Yeah, once you're ready for treatment, you call in. You can go on Psychology Today. You can call ThriveWorks to make appointments. You like that plug, right, Rex? You can call
Yep,
ThriveWorks
exactly.
to set up appointments, and then we'll do our assessments and then see, go from there. Also, some tips that I also would like for people to start doing would be you can Google it, look up your values, your core values, find out what are your core values, because that's the only way you can start making decisions, right? And setting boundaries. If you don't know
Hmm.
what your core values are, you can't. Um, Look up your core values, figure out what they are and which ones have the yes and the no's, and start working towards them, because then that will start to regulate you a little more. Um,
Mm,
Mindfulness techniques, any type of form of meditation, even if it's
hmm.
depression and you don't want to get out the bed, give yourself little time frames, right? So
Hmm.
I'm going to give myself 10 minutes to do X, Y, Z. If I can't get the 10 minutes, if I can't do it within the, I'll give 10 minutes. If I go further, great. If not, I won't. Again, if you're sleeping way too long, get up, go out, get some help. You have to get some help. If you feel like your thoughts are racing and you just can't grab a hold of them, call Psychology Today. You can call Dover Behavior. You can call Sun Behavioral. They'll do assessments with you and then tell you what level of care you need. And then you're around people who are just like you, but going through the process of treatment. Whatever you do, if you can't get up, thoughts are racing to the point where it's affecting your daily life. If you have suicidal thoughts without a plan, still, it's a higher level of care that you will need. But there's help out here for it. You don't have to suffer. We're here to help you.
Very, very well said, Ms. Stacey. And I really do hope that, all this stuff, falls on good ground for those that, eventually end up hearing the episode. And, again, there are options out there for you. Don't feel like you have to stay in your situation because it's familiar to you or because you see everyone else in your environment coping the way that that has become traditional.
Yeah.
It doesn't have to be normalized.
No, it definitely don't. And keep in mind that in order to break generational curses, you have to do something different. And so if you want to make change, you have to change your behavior, right? Because we can't say, I'm going to keep continuing to hold it in. I don't have a voice. Or every time people walk all over me, no, we're not going to use other people as an excuse not to get help. We're going to figure out what causes me to allow people to treat me this way. That's the question. Right? Not why are people walking over me? No, what's causing me to allow people to treat me this way? Yeah. And that's what you get help with in therapy. Right?
Listen, you were dropping some really, really great gems. In the event that, anybody would like to, reach out to you personally or the agency that you work for, how could they get in contact with you?
They just have to go to ThriveWorks website. And then because ThriveWorks moved to a different system. So now people have to call in and set up their appointments. And if they just ask for Stacey Edney, then they'll be able to get on my schedule.
Okay. Awesome. I really am hoping that, we can get yeah, I'm just hoping that, we can continue to use this platform to raise awareness of, the things that we all deal with, no matter the background, the environment, the circumstances, we all go through these things. And, you're a Black woman professional that is helping people work through these. So I'm just hoping that whoever does eventually come across this, whenever they do, that they're able to seek help from people that, literally look just like them and have been through the same things that they've been through.
Exactly. Because it's like, it's like people say, oh, you sit with the book and you only know because I'm like, no, I sit across from this table because I use the same principles that I'm teaching you. I wouldn't ask you to do anything that I have not done or I don't believe in. If I don't believe in it, I'm not going to tell you to do it. Yeah. So I get it. Yeah.
Absolutely.
So you have people that have experience as well around you. Life experience, not just book smarts and all that stuff, right?
Absolutely. And that's something that one of my mentors at the time a couple of years ago had told me that if someone tells you to do something and they're not doing it, don't take it for, word isn't bond.
Because it's like, if I don't believe in it, but I'm pushing it off onto you, then no. I know that if I'm teaching you this stuff, I know it worked because it worked for me. But again, we have to collectively come up with, because there's no cookie cutter way of what works for individual, right? Because what works for me may not work for you, and what works for you may not work for me. But it's good to find out like some different things, and I find out different ways of treating or different ways of doing things because of how different things work for the people I work with, right? So I may have some things that may be like, you know what, I'll modify that. Maybe I can do XYZ with that piece of information you gave me. Just switch it up, change it up, whatever you need to do to make sure that your symptoms are decreasing, right?
Yeah, very well said. Very well said. Well, that concludes everything for today's interview. Once again, I just want to give a huge shout out to Thriveworks Counseling and Miss Stacey Edney for dedicating some time out of her very busy schedule to provide you guys with this wonderful, wonderful information. And not only is it easily accessible, but you guys are getting it for free. We did all the hard work. We did the research. Miss Edney has all of the lovely information already stored in her brain from all her years of experience. And, you know, we just came up with the formula and you guys get the information. So that's what we're here for.
Thank you.
Do you have any closing remarks for the listeners at home? Absolutely. Absolutely. I definitely want to say thank you again for allowing me this opportunity. And everyone just be on the lookout. It's a brand new year. We've got a couple of new concepts coming out in terms of videos and interviews. So just be on the lookout. You guys can follow the King Sales podcast on all social media platforms. You can find us on Instagram, Twitter, and Facebook under the tag kingstalesofficial. And feel free to give us a follow. You can also follow us on YouTube under King's Tales. Don't forget to like the video, subscribe, all that good stuff. And yeah, that's pretty much it. I hope that everyone found some great value in today's interview episode and continue to be on the lookout. Alrighty, let me end the recording real quick.